Problem, but it is not just a health issue. It is an economics issue. Healthcare costs related to obesity are in the hundreds of billions. Folks, you probably didn't get a raise because your company has to put more money into health insurance premiums. Well, CVS Caremark is trying to do something about it, and it's causing a stir. The company's new healthcare plan will penalize employees if they don't weigh in. That's right, reveal their weight to the company by May 1st. Good idea or terrible invasion of privacy? Let's bring in Mimi Roth, president of National Action Against Obesity, and Jeff Stier, senior fellow at the National Center for Public Policy. Mimi, I just have a sneaking suspicion I know where you fall on this issue.
Yes, I weigh 122 pounds.
Wow, I'm double you, actually. I'm actually double you. There you go. So we've revealed it now. You don't have to do it, Jeff. Don't worry about it. But should I have to? I just told Comcast. Should I have to tell Comcast what my weight is?
Why shouldn't you? Here's the thing.
It's none of their business.
Let me tell you something. Obesity has made it everyone's business. It's not just costing raises, it's costing jobs. Corporate America should not be carrying the weight of employee obesity. It's related to life. It's related to lifestyle choice. And just like they say we maybe don't want smokers, you saw the Cleveland Clinic say maybe we don't want to hire obese people. That's where we are.
And we all have to disclose here at NBC if we smoke or not, so why not also disclosing whether you're an unhealthy weight, Jeff?
Well, we've already started going down that slippery slope. We're at about the halfway point, and I think Mimi wanted this because we talked about Obamacare and increasing costs. First of all, this is a private company, publicly traded, but a private company. They should be allowed to do what they want to do. Many employees may choose not to work there now. The issue here is that this is an unintended consequence of Obamacare, that healthcare costs are going up and companies are trying to do more. I don't think this is a very good way to do it. But that's
Jeff, even without Obamacare, employee obesity costs us a fortune. Our population of obesity is costing us all a fortune, with or without Obamacare.
That's
and
a fair
Reuters
point,
recently
but none of this
reported
happened.
that only 8% eat right, exercise daily, don't drink to excess, and don't smoke. So only 8% are even trying.
And they're very boring people.
But Brian, that being said, all of these new intrusive approaches, private sector or public, have only started after Obamacare.
Why do you call it intrusive, though? If somebody's unhealthy, right, if somebody's grotesquely obese and is costing me as a company owner 3 times as much, then my other employees have to suffer for that person.
But that's happening on a nationwide basis. I think Mimi will agree. Nationwide basis across the board because we're all paying for it. That's a better argument against Obamacare than for intrusive-ness.
But
should you?
No, I think this conversation is about employers.
Should they charge more if you're out in the sun too long? They're charging more not only for smokers but for people who are using nicotine, non-harmful forms.
It's about the insurance actuaries. It's how much is it costing us, and that's what they decide.
And that's because Obamacare won't allow underwriting. It won't allow us to charge differently for different risks.
Personally, I think we should have good motivations to stay healthy, whether it's like not smoking, keeping a healthy weight, and also staying out of the sun should be another one.
We should have those anyway.
I think it's good that corporations are potentially taking this on as their own responsibility.
But how far does it go, though?
Yeah.
Right? Because you cannot. Working for a company, revealing your weight is one thing.
Does
this now translate to your point about the Mayo Clinic, I think it was, or whatever? Cleveland Clinic. Sorry, you come in for an interview. You're clearly overweight. We're not hiring you. You know, is that discriminatory?
But is it selective? Don't they have the right to choose who makes up their employee population?
Companies have that.
Not all.
Wait. Let me finish the rest of that.
Discriminate against
when it comes
gender, class, age.
But when it comes to lifestyle choices that increase the overhead.
Okay,
so that's where the line is. I agree you can't be discriminatory, but you can be selective.
Now you guys are on the same side.
That's the result. That's the result.
What the hell happened here?
That's the result of Obamacare. Mimi's been calling for this.
Jeff hit on me in the green room. I just want that to be known.
That's discriminatory. Wait a minute. Is it?
She wants more government intrusiveness and more private sector.
What is he even talking about? We're talking about employers. If employers have to pick up the tab, then they should have the right to decide they're not going to take that on as employees.
Yes.
It's part of the interview process. And if we expect someone else to pick up the tab,
weigh yourself on Google so they can sell the data to the maker of Oreos.
If I could just make a final point here.
Sure.
That is that the government has caused all of this because this is an unintended consequence of government.
By not doing their
Let him finish, Mimi.
This is an unintended consequence of Obamacare because Healthcare costs have gone up. None of this happened a year ago, 2 years ago. It's all happening now. University of Pennsylvania won't even hire tobacco
Healthcare costs have been skyrocketing for a long time.
But all of these changes have come as a result of
Oh, no, the
Obamacare.
Cleveland Clinic was before that.
Okay.
Employers have been looking on how to offset obesity
You know, the
costs for a
Mayo
while
Clinic
now.
would be a great place. I mean, I'm just throwing it out there, the Mayo Clinic.
Yeah.
They might need
Thank
to
you.
change their name.
Miracle Whip
Mayo.
Clinic. You guys finally got it.
No, we're with you.
McFly.
We're with
McFly.
We're
Hello.
going to leave it there. Great debate, great debate. I don't know whether you're agreeing or disagreeing or sort of like going in and out there, but great debate. Coming up.